This video talks about the axillary artery and the axillary sheath. So I put forward a specific example which deals with the axillary artery and the axillary sheath. And so I'm going to talk about this particular example which deals with these two aspects and go back and talk about the basics of axillary artery in terms of its anatomy, and then come back to this question that we have to kind of integrate all that we have learned with this specific example. So let's read the example we have here. So this question says, a 20-year-old man is brought to the emergency department because of a gunshot wound to the left superior chest during an altercation. Physical exam shows weak radial and ulnar pulses, okay, and weakness of the left arm. The bleeding is controlled, and an ultrasound of the axillary artery shows an aneurysm within the axilla. Which of the following neural structures is most likely to be compressed as a result of this aneurysm? So definitely this is a blood vessel problem, and they're talking about an aneurysm within the axilla. So we have to understand what are the structures we're going to find inside the axilla. So let's talk about a specific example in terms of diagrammatic example to see how this really works. So imagine that this is the first rib. This is our first rib, and our blood vessel is coming down this first rib like that, okay, and then it passes the first rib and it continues down the arm and forearm. Now so whenever you're talking about the axillary artery, it's called the axillary artery after it passes the first rib. So from here on, from this point onwards, is called the axillary artery. Just before the first rib, this would be called, should draw on this side, this should be called subclavian artery. Okay, so what's the difference between subclavian artery and axillary artery? Really, there is no difference at all, because pretty much it's just the first rib which really defines the difference between the two. Above the first rib, it's called, anatomically, it's called the subclavian artery, and beyond the first rib, it's called the axillary artery. So I'm going to take it down a little further and talk about a muscle that we have here. So here it's going to be our teres major. So imagine that this is our teres major muscle. Okay, so I'm going to write this down. Teres major. And when this blood vessel passes this teres major, again, this mystery artery changes its name again. And now we are going to be calling this brachial artery. Strange, right? But that's how it is. Above the first rib, subclavian. After the first rib, axillary. After the teres major, it's going to be brachial artery. So now that we have that under control, let's talk about the axillary sheath. So whenever we're talking about the axillary sheath, so let's imagine that this is the guy who was in the accident, and this is his arm. I'm just drawing an over-exaggerated diagram because I'm horrible with drawing pictures. So imagine that this area right here is the axilla. Okay, so inside our axilla here, there's a sheath called the axillary sheath. Okay, we have the axillary sheath here, and within this sheath, we have two structures. First, we have our axillary artery. And second, we have the three cords. And the three cords are lateral cord, medial cord, and posterior cord. So these are all the three different cords that we have here. So within this particular axillary sheath, we have the axillary artery and the three cords. Now, imagine that there is an aneurysm inside this axillary artery. Okay, imagine that this is the aneurysm. What's going to happen? It's going to affect the cords, maybe one or more of the cords, depending on the severity of the condition. So now let's go back to our example and talk about it. So in our example, it says that the bleeding is controlled and the ultrasound of the axillary artery shows an aneurysm within the axilla. Which of the following neural structures is most likely to be? I didn't write down the options because this is not a question where you can guess. You just have to know. That's why you should just know that if there is an aneurysm within the axillary sheath, it's going to be the cord that is going to be affected. So that's why I didn't write down the options. So which of the following neural structures is most likely to be compressed as a result of this aneurysm? It's going to be any of the cords. So it's going to be the posterior cord or the lateral cord or the medial cord. So now we have answered this particular question. I want to take this opportunity and talk about something a little, which can confuse you in an exam if you did not know which of the structures is going to be associated with the axillary sheath, and you can get confused if you try to take your best guess. Right around this area, there is another anatomic question that you can have, and that is, we talked about in a different video, that if there is a rib here, so that's a rib, and you can have above this rib is obviously the subclavian artery. So you can have compression of the subclavian artery, or you can also have compression of the lateral cord, okay? The lateral cord that's running down with the subclavian artery and later on being more part of the brachial plexus. So compression of these two can happen due to injury, trauma, or if you have a cervical rib. And the part of the brachial plexus that is going to be affected if there's compression of these two structures is going to be the lower trunk of brachial plexus. Okay, I feel like I have not explained this, so I'm going to talk about this one more time. So above the first rib, so this is our first rib, we have the subclavian artery and we have the brachial plexus. And if there is any kind of compression on this area, either it's due to a whiplash injury or if it's due to a cervical rib that is there, you will see that you're going to have questions where an electrician works above his head and he gets a tingling sensation which runs down his arm and forearm and onto his hand. And that kind of example is an example of the compression of the lower trunk of the brachial plexus. It's never the upper trunk. It's usually the lower trunk that is affected. Sometimes the subclavian artery is also affected. Usually subclavian vein is not the most common one. It's around 3 to 5% of the cases subclavian vein is going to be affected because subclavian vein passes on top of the of a specific muscle, and the name of that muscle is scalene muscle, anterior scalene. So so in that scenario, when we're dealing with an anatomical or a clinical scenario above the first rib, we are dealing with lower trunk of the brachial plexus. Whenever we're talking about beyond the rib, in the axilla, here we're talking about the cord. So you can see how before the first rib, there is the brachial plexus that is being, the lower trunk of the brachial plexus that is being affected. After the rib, the first clinical scenario we can think of is in the axillary sheath, and it's going to be the cords that is going to be affected. So I just wanted to draw that scenario together just to give you an idea so that you don't get confused with the two concepts. Anyway, so that is my interpretation of axillary artery and the axillary sheath. Hope you liked it.